Hi, Matt Goodwin with Inspire Cosmetic Surgery. Today I'm going to talk about upper arm contouring surgeries. So, as we age or we have changes in weight, sometimes we have an unpleasant contour to our upper arm. Typically in the upper arm, we would like to have some sort of definition that demonstrates the muscle and the upper component called the biceps muscle in relation to the triceps muscle, which is in the posterior arm, as well as in relation to the shoulder muscle called the deltoid. Now, as we have excess fat or excess skin, sometimes that muscle is less visualized. So in an effort to try and define that muscle, we may need to remove some fat, some skin, or both. If we just need to remove fat, typically that's when we think that the skin has enough elasticity with some removal of fat that it's going to contract and still give a nice contour to the arm. And in that circumstance, typically we use a port at the elbow, one of the arms, and maybe a couple others to help remove the fat in multiple directions in the arm. Now, sometimes a patient might have excess skin, and because of gravity, the arm skin might hang down below the upper arm, and patients complain about this and might call it some flab. And in those circumstances, we have to remove the excess skin. The problem with that is there's going to be a scar. Typically, it involves removal of skin somewhat in an ellipse shape from just above the level of the elbow to the armpit area. So usually we use it in the lower portion of the upper arm, and we try to hide that scar in the medial portion of the arm. Sometimes we have to remove a little excess skin in the armpit as well, and there may be a vertical component as well. Sometimes this procedure is combined with breast contouring surgeries, and they might connect the scar with a breast contouring surgery as well, such as a breast lift or reduction.